Good morning, everyone. I am here with Dr. Diane Zosky, who is the director of the School of Social Work. She has graciously agreed to speak with our class today about her experience as a social worker in a hospital setting. As you know, we are in Chapter 7 and we're talking about social work services and healthcare. So, Dr. Zosky, talk with us about what your experiences have been. Like, what led you to social work?
Yeah, okay. Oh, that's a very good question, actually. And I would start by mentioning that I think one of the things that led me to social work as a general profession is really the great breadth that's involved in our profession. You can work with so many different kinds of people, so many different settings, so many different issues that we work with. So, I mean, you can work, I certainly have experience in healthcare, you can work in that, you can work with schools, work with children and family, mental health, substance abuse. So there's so many different areas, so many different ages of people. So I felt like, I was called to, I felt like I was called to a profession where I was really going to contribute back to making this a better world for all of us to live in. And then the beautiful nature of so much variety really kind of drew me to it.
Okay. So, talk with us about what your experiences had been when you
Mhm.
were working in a hospital.
Yeah. And I did work in an acute care hospital setting, but I just talked about the variety of the profession, and that's one of the things that was really, I think, stimulating for me working in a healthcare setting is the amount of variety that a social worker can find themselves serving in a hospital setting. My very first job, this was out of graduate school, I worked in a level 1 trauma center,
Mm.
which was really fascinating. I often say that it was probably the most interesting job I've ever had as a social worker. So this was a trauma center. My job as a social worker was really to deal with the families. Patient would come in, they would be whisked into the trauma bay, and the medical staff trying to save their life, literally. But then the family would show up at the hospital, accompanying the patient, and you can imagine the amount of stress, concern, fear, worry, anxiety that a family member would have. So I would be basically their support while their loved one was being cared for. From there, from there I moved to a hemodialysis unit,
Mm.
working with people who were awaiting kidney transplant. At that time where I worked, it was at OSF St. Francis in Peoria, and we had just begun to do kidney transplants there. So working with people both on the chronicity of their health when they were on dialysis, but then also all of the anticipatory anxiety for the patient and the family about looking forward to a transplant. From there, I moved into a rehab unit and also a neuro-intensive care unit. And since we were a level 1 trauma center, we had a lot of people with spinal cord injuries, so people with paralysis, whether they be a quadriplegic or a paraplegic, people with traumatic brain injuries. And again, my work was probably, I'd say, 70% more working with the family members, maybe 30% working with patients, in terms of all of the adjustments that go with literally a life-changing event such as those. Another really interesting job I had in healthcare was working in hospice. And this was a very unique assignment. I wasn't a direct care provider in hospice, but what I did, and this was kind of a part-time gig, is I worked for the hospice team.
Mm.
You can imagine hospice workers from physicians to the nurses to the home care aides to the chaplains to the social workers. How that is very rewarding work, but also a work that takes a toll in terms of vicarious trauma of, you're seeing death, um, uh, with every single patient, and every single family member. So it's really quite um, a sacred and noble calling, but it also takes a toll on the providers. So my role was to meet with them on once a month basis and have basically a group processing for the team in terms of how they're dealing with all of their feelings about working with death. You can work in healthcare, you can work in an acute setting, which is where most of my work was, but you can also work in long-term care settings in terms of skilled nursing facilities, assisted living facilities. As we know, the demographic population of older adults is expanding, so there's a lot of a need there. You can work in a home care setting.
Mm-hmm.
There's just so much variety in many different places to work in healthcare.
What about NICUs, working
Mhm.
with young
Mhm.
moms and
Yep.
babies who are born with complications.
Yep, that's another niche for a social worker. And again, at OSF St. Francis, they're a level 1 NICU unit. So we did have a social worker that worked there. I was never deployed to that unit, but I certainly know of social workers who worked in that setting. You can imagine a family member who would have a newborn infant that comes prematurely or with just challenges, and you can imagine how frightening that is, going through 9 months of anticipating this new life, and then realize that the baby's life might really be in a precarious situation. So a lot of anxiety for those parents, a lot of worry, a lot of help that they might need, just linking them to resources that would help in terms of caring for their baby once they return home.
So when you think about social work services and healthcare and what a social worker working in a hospital setting, the attributes and skills that social worker has to have, what would you say are some of those skills and attributes that a social worker should possess?
Yeah, I can think of several. One in terms of just the interactions with our patients or as we might say, clients in social work and their families. Certainly the ability to really therapeutically listen and supportively listen, because you can imagine the many different emotions that go through someone's life as they have a loved one or their own care, in a hospital. So really being able to listen, be supportive, help processing all of that. But then beyond that, oftentimes they'll need a lot of services once they leave the hospital. So know about those resources and being able to link them up. So those are two areas: supportive listening, being able to link you to resources. But here's a third area, literally, and this is unique about hospital social work. You're working in a host setting, what we would call a host setting. It's not a traditional social service agency. You're working with an interdisciplinary team of providers, like nurses and doctors and all sorts of other. I worked with physical therapists, speech therapists, occupational therapists, psychologists, and you actually are also called to provide care to your teammates, in terms of helping them understand the patient and the family, helping them deal with their stresses. So you're also, in a sense, a consultant to the rest of the care team as a social worker.
Okay. What parting words of wisdom would you have for my students that might be thinking about pursuing a career in social work, and maybe more specifically social work in a healthcare setting? Like, I have one student who is a psych tech right now down in St. Louis, and she's talked about how a lot of the things that she sees and working closely with the patients on that unit, and is considering getting her MSW. But what words of wisdom would you give for students that are interested in going into this field, and more specifically working in a hospital setting?
Yeah, I guess I would say a couple of things. And the first thing I would say is that I think it's a very rewarding environment to work in, because literally you are with people during probably the most vulnerable times of their life. And sometimes those most vulnerable times of their life is actually handling death, So it's really rewarding. It is a privilege and an honor to be with people during those times. So that's one thing I would say. Second thing I would say is because you're working in a host setting, cross-disciplinary, the pay tends to be rather attractive because your pay will parallel the pay of other healthcare providers as a social worker. So it does tend to be a little bit higher pay for social compared to other settings that you might work in. So that's nice. But here's the thing I would say, whether it's a healthcare setting or any setting in terms of social work, here's what I often say to our students is you can do a lot of things in life to make a buck. Can you always make a difference? And our profession, social work, makes a difference in life, and sometimes that's way more rewarding than what can be counted in terms of a paycheck. That's why I was called to the profession. It was important for me to contribute back and make a difference in this life. Before I leave this life, I want to make sure I've made it a better place.
Well, thank you, Dr. Zosky, for sharing your wisdom about your experiences in social work and more specifically healthcare. I hope you all take heed to what she said, because you will see this on your quiz. Thank you.
Good luck on that quiz.